Continue our tour, our Corona tour around the world. And today I have a dear friend and colleague, Dr. Javier Morales from Puerto Rico, an infectious disease specialist who worked shoulder to shoulder with me during the AIDS pandemic and is now also dealing with the coronavirus pandemic in Puerto Rico. Hello, Dr. Morales. Javier, how are you today?
Hello, Nancy. How are you? It's a pleasure to be with you.
It's a pleasure to be with you. Thank you. How are you and your family, and has this virus affected you personally?
Uh, Fortunately, all my family is okay. Daughter, my son, grandchildren, my wife, my brother, and his family. Everybody is fine.
That's
Fortunately.
fine. Um, First, before I continue, I want to thank you because I know you are one of the people that are continuing to go out there, see patients, and that is a something that we have to admire and thank you for. So thank you for doing that for the
Thank
patients
you.
and for people in Puerto Rico. Tell me a little bit about the situation in Puerto Rico. Have you been able to contain the virus, and what kind of measures have been put in place in order to accomplish that?
Okay. To tell you the truth, I expected much more cases than we're having. I expected intensive care units to be full, patients on ventilators. Uh, it's not the case. Not many. You can see empty beds in the intensive cares and the hospitals. Not that many COVID patients so far. But 6 weeks ago, the government said we are going to be on quarantine, and that I think that have worked. People are in their homes. Only essential workers like healthcare workers and maintenance, gas stations, pharmacies, and supermarkets are open. Uh, from Monday to Saturday, everybody can work from 5 o'clock to 7 o'clock at night, 5 o'clock in the morning, and to it was has been a good surprise how disciplined our people have been in this quarantine. You go to a supermarket, the workers in the supermarket and the people that are going to buy, customers are following so strict distancing, face masks. We implemented face masks before anybody in the world. We said we have to use them. And that distancing, I think, is working. And people are very, very aggressive in cleaning what they buy in the supermarket. And the distancing and the discipline has been remarkable. I'm glad to say that.
Well, that's fantastic. And I think that's probably why the hospitals, as you have mentioned, are not as overwhelmed as they have been here in the United States and in Italy and Spain, where it has been a
Yeah,
disastrous type
I
of
know.
situation, right?
I know.
There's been some discussions that heat and humidity eliminate the virus. However, there's been reports in Puerto Rico and Brazil, even in the Amazon, in Korea and other countries that are hot and humid. Um, do you think it's the heat and the humidity, or do you think it's the physical distancing, the mask wearing, and the infection control measures that people are taking?
Heat and humidity always have been a talk point, and not only in this COVID or also in influenza, of course. Uh, but in the northern hemisphere, southern hemisphere, when you're in the winter time, you have influenza because you're not out in the streets playing and in the park. You're also always in close uh, quarters, and I don't know. Nobody knows. It may help. It may help the virus that is on the surface, but nobody knows for sure. I know there have been mixed information about disinfectants and heat and humidity. But there are a lot of countries that are hot and humid or hot and dry. When we had the MERS and the SARS, and still it just went away. I mean, he just attacked people at the same rate. It was controlled, of course. It was a different type of virus, a different situation. But I don't know. I would not rely on heat and humidity because that would help us because Puerto Rico is always hot and humid. So I would not rely on that.
So I think what we're saying is that the disciplined
Discipline.
physical distancing and infection control measures are more important than anything else.
Yep.
Yes.
Discipline and distancing. That's the key to control this. Discipline. I'm concerned that when you start opening businesses and services, we have to emphasize the social distancing anyway. If you work, keep on using your mask and cleaning, and there have been protocols for that. Because I don't want, for example, the people that may think, okay, now I can work. Maybe this virus is coming down. You know what? I'm not going to use a mask. I'm going to have a beer uh, and so forth. So education has to be going on all the time about the social distancing, even if we start working, because this virus is going to be with us for a long time.
Okay. You are not only an infectious disease specialist, but you're also an expert in HIV. Can you tell me if there's been any impact or any difference in the cases of coronavirus in HIV patients?
No, 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 no. I haven't heard anything. I've talked to friends and colleagues that are seeing HIV patients, and so far nothing out of the ordinary. Of course, if you think social distancing is working for the average person, imagine an HIV patient that thinks he's more susceptible. He's double he's double caring about himself. I haven't seen anything to be concerned about.
Well, that's great news to hear. Javier, thank you so much for your time. It's a pleasure seeing you virtually, and hopefully the coronavirus will allow us to give each other a hug soon.
It's very interesting, Nancy, is that we are Skype right now, and we can talk to everybody through the internet, but still the human feeling of embracing and hugging and handshakes is so much needed. So no, doesn't matter how much technology we have back to the basics.
Absolutely. Well,
Back to
thank you
the
so
basics.
much for
That's
your,
good. Okay, take care.
thank you. You too.